I want to thank everybody for coming, and what I really want to do is just take a few minutes to give you the details of the national standard for a psychologically healthy and safe workplace, which is we're now announcing today, and the work of which is about to get underway. This is really a first in Canadian history. I was chatting with the presidents of the BNQ and the CSA, the Quebec and the rest of the country's standard-setting organization, that it is interesting that this is the first time they've had to deal with the issue of trying to set a psychological standard as opposed to the more traditional kinds of health and safety standards they have to deal with. The question then, of course, is why are we doing this? I just want to give you a couple of facts that really help to emphasize this. It's estimated that between 10 and 25% of workplaces in Canada are effectively mentally injurious. That is to say, they are not good for the mental health of their employees. And let me give you a couple of facts that bear this out. Mental health is by far the leading cause of short-term disability and long-term disability. It's the biggest single reason people are off work for periods of time. The economic burden of mental health in the workplace has been estimated at $51 billion. By the way, that's up substantially in the last decade. And because what it costs is not just the people who are off on disability. It's not just the people who are off on sick leave. The issue of presenteeism, in which individuals come to work but are in fact not really fully capable of doing the job, but are afraid to go off on sick leave to get better because of the stigma in the workplace and their fear of telling either their employer or any of their fellow employees that in fact they are suffering from mental illness, that they're suffering from anxiety disorder, that they're suffering from depression. And so we have this issue of presenteeism, whereby the productivity of individuals, many of them coming to work, is in fact significantly worse than it would be if they were treated and made better in the first place. In addition to the number of employees that are impacted, there's also a very significant changing legal landscape going on in Canada and elsewhere in the industrialized world. We had a report, we being the Mental Health Commission, had a report done last October by Dr. Martin Shane, a leading expert on workplace mental health from the legal standpoint. And his report was called Tracking the Perfect Legal Storm. And one of the facts that's very striking, I think, for employers is that over the last 5 years, the increase in damages awarded for workplace mental health injuries is up 700%. It's gone up by a factor of 7 in the last 5 years in terms of awards that have been given either by courts or by workmen's compensation boards. So courts are now starting, the legal regulatory framework is now starting to recognize the importance of mental health and the importance of ensuring that employees are treated properly and in a mentally healthy workplace. So all of these facts combine to encourage the Mental Health Commission to really champion the issue of mental health in the workplace. We understood that our role as a catalyst, and that's really what the Mental Health Commission is, our role as a catalyst was to try to get the various forces in the country who would be interested in this issue or ought to be interested in this issue to come together to begin to develop a standard. And as I've already said, it's important to employees. It's also important to employers, the ability to, the cost effectiveness of reducing the number of people on short-term disability. Let me remind you, short-term disability costs flow right through to the bottom line. They are paid for out of operating costs. They are not insured. The cost of long-term disability is also an impact on the company, and as I said, the issue of presenteeism is also enormous. And so what we're proposing and what the CSA and the BNQ are going to develop for us is a standard which is a voluntary standard, and a standard which is designed to give both employers and employee groups standards, targets, ways of achieving an improvement in the mentally healthy workplace, and to do so in ways that are measurable, that can be sustained over time, and which will allow you to track your improvement. So I repeat, the voluntary nature of this is critical, but it's also critical that it be measurable and we be able to track it over time. We have a number of partners working with us in terms of particularly the CSA and the BNQ. So this standard is going to be developed exactly the same way any other workplace health and safety standard would be developed in Canada. The process is the same. So we are not doing something that is completely out of line with established practice. The funding for the project has come $325,000 from the federal government through HRSDC, Labour Canada, Health Canada, and the Public Health Agency of Canada, and $150,000 from Bell Canada, which, as you know, is the leading corporate supporter of mental health issues. Bell Canada is contributing $50 million a year over 5 years to improving the mental health of Canadians, and $150,000 of that is going to, as a significant contribution to paying for the development of this standard. As I said, the standard will be developed according to normal processes. The intention or the work plan is essentially to put out a draft standard late this fall, certainly by the end of the year, to then, as is the normal case, have 60 days public commentary on it in which the views of all interested parties will be sought, and then they will bring it back, and the final version of the standard will be done and finished and hopefully promulgated by this time next year. So our intent would be to finish this entire process in more or less the next 12 months. The voluntary nature, I know that I say this for employers, the voluntary nature of this issue is critical, and I know people on the other side will say, well, if it's voluntary, how is anything going to happen? And the answer to that is really very simple. If you look at the way changes like this really get implemented, they get implemented because you get a small number of leading corporations and unions who are prepared to come forward and say, we really want to make this happen. And after that, peer group pressure gets to the point where people, in fact, have to adopt it because that's what the workplace requires and because the economics of it are overwhelming for the employer. And from the employee's point of view, they absolutely want and will start pushing for a more psychologically safe workplace. Before I close, I just want to thank two people with the Commission who have really been responsible for making all this happen. One is Dr. Ian Arnold, who's up there on the panel with me. Ian is the chair of our Workforce Advisory Committee. He was retired till he took over as chair. He's still unpaid. He's just not really retired. He has done an unbelievable job. He came to the Commission having had a number of jobs as Chief Medical Officer for a number of corporations, including his last one, which was the Chief Medical Officer for Alcan Worldwide. And to Dr. Jane Barker, who was Vice President of Research and Policy for the Mental Health Commission and who has done an unbelievable job of pulling all together all the various factions in the country together in order to make this work. And so in closing, I just want to say to all of you that I think this is a very big day for mental health in Canada. It's the first real tangible step towards improving workplace mental health. And let me remind you, 70% of the people in Canada with a mental illness are in the workplace. So this affects a great many people. And so I think this is a unique opportunity for all of us who really want to reduce the impact of mental illness on Canadians. It's an opportunity for all of us to say this is the first step forward in what is going to be a very successful program, and I think a very rapid take-up of the new standard before it's announced.